Hello, this is Dr. Bhaumik, and welcome to the second part of my lecture, and that is the history of ancient medicine in India, Ayurveda, part 2. Now, in the first part, I have uh, introduced Ayurveda, introduction, and then we did discuss about the mythological connection of Ayurveda, the Ayurvedic Trimurti is Brahma, and the avatar of Dhanavantari. At the same time, I also discuss about the, the key point which a Ayurvedic physician need to know well to maneuver his therapeutic method. They are dosa, panchabhuta, and prakriti. At the same time, I did discuss the connection, deep connection with Veda, Upaveda, and the of history and essence of Ayurveda, and therapeutic maneuver that has been used by the Ayurvedic physician, and I have also discussed that. In the second part of the discussion, I'm going to reintroduce with some of the essential slides, few, and then we are going to start our series with the second part with the second avatar of Dhanavantari. The second part is actually very important because I am going to discuss about the rishis and maharishis of the yoga in the Ayurveda. At the same time, I am also going to discuss the three great names in Ayurveda whose contribution to the Ayurvedic medicine is undeniable. And at the same time, I will also discuss at the end the status of Ayurvedic medicine in India and other parts of the world. So, therefore, without further, and I'm going to introduce myself again. I'm Dr. Bhaumik, Samar Bhaumik, and I'm a physician, Western trained physician, ex-professor of pediatrics, and also retired military physician, the rank of colonel. Now, in the part two, as I have mentioned, that I'm going to introduce some of the basic concept of Ayurveda and the history. And the Ayurvedic medicine is more than 3,000 years old and the oldest medicine that known to any civilization. And in my research and reading, I found next to that probably will be traditional Chinese medicine. So it is therefore the most ancient medicine in the world, and it emphasizes the holistic, preventive, and also the therapeutic measure. But most important is holistic and the preventive. A Ayurvedic physician has to consider mind, spirit, and the body, and the key point like dosas, prakriti, and punchamahota of that given person. This is highly respected in India, and it is practiced in many other countries, and I'll mention briefly about that as I continue to have the discussion. And it is a Essence of Ayurveda, it is a timeless universal system of medicine. It is a Sanskrit word. Ayur means life and Veda means knowledge. It's a knowledge of life and which is actually the human body, human spirit, and the medicine, Ayurvedic medicine. Patient confidentiality is of utmost importance, which is even practiced today. And prevention is better than cure, since in many instances the cure may not be available, but the prevention is the most important thing. And it is very much like Hippocratic Oath, which actually came later. However, in Western medicine, Hippocratic Oath is very well known, and all physicians need to take that oath before he or she starts her medical career. In addition to all other things that I have mentioned, the later addition that did not come exactly at the time Ayurveda started, but it was added at the end of the century, and this is mind and the body. Mind is the meditation, and this way you can achieve some of the tranquility of the mind and the rest of the mind, which is very important because in Western medicine, we do know the stress is the most important factor in a disease process. And its healing is also important to have a tranquil mind. And the body is yoga. The yoga is actually the exercise, different kind of exercise that will strengthen your body, joint and muscle. And it is very important part of the therapy. And indeed, it has been now incorporated in Western medicine as well. Therapeutic approach of Ayurveda. I mentioned this one briefly in the first part, but the Ayurvedic physician believes the cleaning of him or herself cleanses cleaning is very important, and internal cleaning that is achieved by cleaning the gastrointestinal tract by purgation, detoxification, and emesis, the vomiting. Indeed, there are many people in India and outside of India who is a big believer of Ayurvedic medicine. Once or twice a year, once or every 2 years, goes to Kerala and get that achieved by those procedure, by those method. And beside that, there is, when you talk about the therapeutic maneuver, it is the herbal medicine, massage therapy, yoga, meditation. Yoga meditation, and this is a very important part of the approach to the Ayurvedic treatment. Now the lecture, the second part that I will be discussing with you is the second avatar of Lord Dhanavantari. In first avatar, I discussed that how he appeared in front of the devatas and Ashur with a jar of Amriti, and that gave the longevity of the devatas. And so I'm not going there. So that was first avatar. And it is believed that he did not come to the world that quickly because he needed some more training. He was trained by Kumaras, Ashwini brothers, and Lord and the Supreme God Brahma himself before he was sent to the world. He was born at Banaras, which is Kashi, and there is a little difference of the opinion, but I use the one that I found many people use that reference of Agni and Vishnu Puran. So he was the son of Dirgatama. Dirgatama was a sage, king, and very pious man. He, however, was disturbed by the fact that he has no son. So when you have no son and you are a king, who is going to take over when you are gone? So that was a very big concern. So by the suggestion of Rishi Bhardwaj, he started praying to God Vishnu. And the Vishnu was so pleased with his meditation and prayer that Dhanavantari was born in that family, and which is actually believed to be a avatar of Vishnu, incarnation of Vishnu. There are people, they worship Dhanavantari for their health, and this is usually done on the first day of Diwali. And the Western scholar has been compared him to Asclepius of Greek medicine. Asclepius was a great anatomist. He did the dissection and he was a great surgeon. That was pretty much what Dharavantari did in his era. And Asclepius was the son of those who are interested in Greek mythology, is son of Greek god Apollo. Now I'm going to mention some of the great name scholar in Ayurvedic medicine. The first one is obviously Lord Dhanavantari, who is considered a god of Ayurveda. Then there are two other names, Maharishi Bhardwaj and the Rishi Koshipu and many others. But these two stand because they are the part of Saptarshi, the seven stars that you see in the sky, Rishi Bhardwaj and Koshipu. Rishi Bhardwaj and Koshipu was great scholar, and they spend a lot of their time by teaching Ayurveda to others. So he was before the other trinity of Ayurveda, which I'm going to discuss later, and he actually taught Ayurvedic medicine to those Maharishis like Charaka, Sushruta, and Vagabata. And so, if somebody wants to discuss about these rishis, Bhardwaj, Kashipu, and other, and you can spend more than lecture, and there are so much written about them. So I just give a very brief name of those rishis just to recognize their contribution to the Ayurvedic medicine. Now I'm going to spend more time with these three Ayurvedic physicians. They call Three Ratna or Trinity of Ayurveda. The first one I am going to discuss is Maharishi Charaka, then Maharishi Sushruta, and then Bhagavata. Maharishi Charaka was the first name that will come in Ayurvedic medicine when you are discussing the history. He believed to be born in Kashmir around 300 before Common Era or before Christ, you can say. And he is considered his father of Ayurvedic medicine. Dhanavantara is the Lord and the God of the Ayurveda, and Maharishi Charaka is the father of Ayurvedic medicine. He was disciple of great Rishi and the scholar in Ayurvedic medicine, and the philosopher himself is Punarvasu Attri. And he was also taught by Rishi Bhardwaj. His specialty was, if I go by Western medicine, is Kaya Chikisha or internal medicine. His great contribution also included, remember that I did discuss the key factor in a human being we all have it different, like Prakriti, Tridosa, and Panchamahabhuta. And he clarified it a little bit further. He added and modified. And great achievement. He's divided the medicine, Ayurvedic medicine, in 8 branches. Just imagine that even that time he branches, and that called Astanga Ayurveda. 8 branches of Ayurveda, which I will discuss in next slide. So he explained the humoral and biomaterial of dosas. Not the like, if you remember in dosas, it's like external appearance. Somebody may be chubby, somebody is skinny, somebody has a leadership quality, and their strength and weakness was discussed. But he did even going beyond that, and he explained the humoral and biomedical of dosas. And he proposed Shaptodhatus. Shaptodhatus, these are rasa. Rasa is plasma and lymph, and rakta, which is blood, and 3 is mamsa, muscle tissue, metha, fat and adipose tissue, asti, asti is bone and cartilage, and maja is bone marrow and nervous tissue. And lastly, the sukra, very important, is the semen and reproductive tissue. So he did propose and discuss those in details in his book. He is the first person known to write a internal medicine textbook, and that's known as Charaka Samhita. Charaka Samhita. And he is the one, again, he emphasized the importance of prevention, which is the very same motto of World Health Organization. He did not advocate dissection, and which he considered is the humiliation of human body and should not be done. He rather advised his student to see the inside of the human body by the inner light of their eyes. So with the inner lights of the eye, try to see what's going on in the patient body rather than dissection. And again, patient confidentiality must be kept at all cost. The 8 branches of Ayurveda that he proposed are as follows: Kaya Chikisha, internal medicine, Shoila surgery, and Shoilaka Tantra head and neck, Kumaravatra is pediatrics, Agda Tantra, which is toxicology, and Bhutavidya is psychiatrist, Rational is prevention, and the Vijukarma is the last one, is the Vijukarnas are fertility, study of fertility. Now I want to discuss a little bit about another great Maharishi who is actually more known in West than Charaka. There is little difference of the opinion, but as I read more in Western history, I found more name of Sushruta. He was born around 6 to 800 BC at Varanasi, again at Kashi. He believed to be the son of sage Vishwamitra, and is those who know anything about the Hindu religion, they know about Vishwamitras, and he is very revered rishi. Maharishi Sushruta was considered as the father of plastic surgery. In Western medicine, he is very much well known for his first performance of rhinoplasty. Rhinoplasty is the repair of the nose, and which I'll just go a little bit in my next slide. He was believed to be disciple of Rishi Devadasha, and he was also taught by Lord Dhanvantari himself. Maharishi Sushruta is considered also as Asclepius of Greek medicine, son of Apollo, whose specialty was anatomy and surgery. His famous statement was different than what Charaka said. His famous statement is that the disease of our organ can only be diagnosed properly by knowing the position, location, as well as inside and the function of the organ. Therefore, he did do the dissection. A dissection, it is believed that time it was considered as a very detrimental things to do on the human body. And so he used to hide himself, and his night with his pupil, I used to perform dissection in a lake or pond. He used to collect body and keep them for a few days so that it will be soft and they can do the dissection. And he, like Charaka, wrote his own book called Sushruta Samhita. This is a surgery textbook. This has been translated in English now as well. And Chakri Samhita is also translated lately in English. He performed rhinoplasty by using the skin flap from the forehead, and his work is so respected. A great surgeon from Columbia University, Dr. Whipples, who is famously known as Whipple's tried, is famously known for that tried to diagnose the low blood sugar, hypoglycemia. And the great surgeon of that time, and he pancreatic surgeon of that time, he made a statement and considered Maharishi Sushruta as the best surgeon in that era and beyond. Sushruta not only did the rhinoplasty, he did more. surgery in the form of C-section head neck surgery as well. He also discovered or invented, I would not say discovered, he was invented about 100 surgical instruments, and some people say it is even more than that, and performed the surgery in other organ, as I mentioned. He is the first one who got the idea of using anesthesia to blunt the pain of surgery. So what he did, he used alcohol to numb the sensation and psychological alteration, and he also used the band, tight band, so that it will numb the pain in that area, distal to that band. It is believed that although he spent more time with surgery, but he is the one who discussed and wrote the sweet urine of diabetes mellitus, manifested by polyuria polydipsia. I'm just going to tell just a small story that I read about this. That Sushruta, one adolescent boy, used to come to his hermit in his house almost every other day, and day by day he is losing all of his strength, muscle, and the fat, becoming very skinny and about to die. Maharishi saw this kind of patient, and he said that they universally going to die, there is nothing can be done. One day he is riding his horse and going to possibly see other patient, and the boy came earlier, and he was walking on the uh, village street, and every couple of 100 meters he was peeing by the side of the road. He is urinating by the side of the road. And Maharishi saw from his horses that his urine is a little bit different than the people that he has seen, or a healthy people. And what he saw that his urine is whitish. He's covered with white pigments. And he came down and he saw the lots of ant is sitting on the urine and making a feast. He immediately called the boy and said, come to my house, and then say, okay, he gave him a little cup or container to urinate. And then he himself tasted the urine, and it was sweet. And that is what gave the name of sweet urine. And this is written in the history of diabetes, an ancient scholar who has contributed, and Sushruta's name is there as well. His work was translated in Arabic first, known as Arabic, and the name of the book is Kitabi Sushruta, and this was written around 800 AD by Caliph Mansi. Maximilian Kessler translated his book in Germany in 1907. Kaviraj Kanjiwalal from Kolkata, India, translated his book in English in 2008. It is believed that his original palm leaves scripture escaped in museum in Nepal and Los Angeles City Museum, and possibly in Mahabalipuram in India. A statue of Sushruta is displayed at Australia and Royal Australasian College of Surgeons in Melbourne. And that's what I said, that he's pretty seems to be more well known than Charaka. Now the last rishi, but not the least, I'm going to discuss is Maharishi Bhagavata. Maharishi Bhagavata was born in 6th century at Sindh province, now in Pakistan. This great contribution, he completed the incomplete Samhita of both Charaka and Sushruta. So they did not finish. There are a lot of area that needed to be added, discarded, just edited their book and made it complete. He also wrote his own book, Ashtanga Hridayam, and written about 7,000 or more sutras, which has been included in the Ayurvedic text. He also the author of Ashtanga Sangraha, is an extensive textbook of internal medicine, surgery, and gynecology. So he added more to the knowledge and introduced more of the concept and sutras than the other two rishis. But he came later. He learned all this thing. He is a disciple of Chakara and Sushruta. Now, he was influenced by a Buddhist scholar, philosophy, and he is not considered not as a human being. He is a devata or deity, Avalokhi Sarava. His name suggests a deity who is always looking down to the people of the earth with a blessing eye and prayer for all of them. Although people might say that Buddhists don't believe in God, true, but they still believe in some devatas and deities. And many consider him as the most important contributor to Ayurvedic medicine, and he was given the title of Virat. Virat means big, Virat, greater tribe of Ayurveda, has given more prestige than the other Ayurvedic physician. His work was translated in various languages, including Arabic, Persian, and also in English now. However, many Orthodox Hindu scholars criticized some of his work and did not like many of the things that he mentioned in his book because of the fact that the more I read, more I am convinced from the different sources, because his faith later on became a Buddhist faith rather than Hindu faith. His father was Brahmin and mother was Buddhist, and he may have accepted that Buddhism the later part of his life. And I believe that his work, some of the things was criticized, and those who are the one who criticized is very orthodox Hindu scholar. However, Bhagavata's work was defended by many scholars and he himself, those who supported him. I just want to finish with some of the remarks in the present state of Ayurvedic practice in India. And one of the things that I find out, and I personally have seen that, like traditional Chinese medicine and the Western medicine in China, they get along really good with each other, and they said they are complementary to each other. However, I did not find any such relationship between traditional medicine in India, which is Western medicine, and Ayurveda. And there is no cordial relationship. Anyway, in order to get a bachelor degree in Ayurvedic medicine, you have to have a 2 years course, and about 5 years course will give the degree is doctorate in Ayurvedic medicine. I'm not so sure whether it has changed, but this is what I gathered. In United States, in all 50 states, you can practice Ayurveda, what is regulated by the states. More than 1400 plants has been added to the Ayurvedic pharmacopoeia, and one of the most important was Ashtagandha, which is known as Indian Ginsu. The Ayurvedic institution in India is approved by the Central Indian Council in 1971. There is more than 450 Ayurvedic colleges, and there are probably more number if we consider the private one. But there is about 57 government colleges, and the oldest and the best one is Banaras Hindu University. And in United States, there are few recognized colleges in Maharishi University of Fairfield, Iowa, in California, and few others in USA in different places. And there are some schools in United Kingdom as well as in Australia. As there is more Indian diaspora in those part of the world, and it is even practiced in the places like United Arab Emirates and Oman. In presently, it's heavily practiced in India, especially in Kerala. And as I have mentioned, that it is practiced in 50 states, regulated by the state, and it takes 2 years and 5 years to get the appropriate degree. And most important, Ashwagandha is Indian ginseng, but other is turmeric, tulsi, triphala, amla, and many others. So I try to put the history together. It is hard and it is difficult, since there are other people who probably have written history and they may have a different sources. So I took the one that I read and mostly believed by many. As a student of the history, I have not criticized any form of treatment or who is better and who is not. I just stated as I found in my reading and research. And I was surprised to see that so much have been written in Ayurvedic medicine, and some of the things like Hippocratic oath and patient confidentiality was believed so strongly even there. I had very little idea about Maharishi Charaka, Sushruta or Vagabata, so I gained a lot of knowledge in that area. I like to apologize because of the pronunciation of some is varies in the different parts of the India, and so it may be pronounced differently in certain part of the India. But with that, I like to thank you for listening and understanding. If there is any controversy and other thing, that's not my doing. And then again, nobody was there when all these things are written, so nobody could be 100% perfect. Thank you very much.